All right, today we are diving deep into one of the most incredible and honestly most overlooked systems in our body, the respiratory system. We're going to treat it like a blueprint, a user's guide to the amazing machine that keeps us going with every single breath. Let's get into it.
I mean, seriously, have you ever just stopped and thought about what's actually happening when you breathe? It's something we do, thousands of times a day, completely on autopilot, but the journey that one little breath takes, it's way more complex and fascinating than you'd probably think.
So, to really get a handle on this, we've got to start with the fundamentals. We're going to follow the air from the outside world all the way into our cells and look at the three key processes that make it all possible. So, think of your respiratory system as having two main zones. First, there's the upper tract. That's your nose, your sinuses, your throat. It's kind of like the air's first checkpoint. It gets warmed up, humidified, and cleaned. From there, it heads down into the lower tract. This is the whole network of tubes that deliver that air deep, deep into the lungs for the main event, the oxygen exchange. Okay, first up is a word you've probably heard, ventilation. All this means is the physical movement of air, breathing in, breathing out. It's the engine that drives the whole system. The goal here is simple. Get that fresh air into the millions and millions of tiny little air sacs in your lungs, called the alveoli. Now, once the air hits those little sacs, the next step, diffusion, kicks in. And this is where the magic happens. It's an incredible exchange. Oxygen passes from the air right into your blood, and at the very same moment, the waste gas, carbon dioxide, passes out of your blood to be breathed out. It is the most critical trait in your body, and it happens in a split second. And the final piece of this amazing puzzle is perfusion. This is all about blood flow. You've got this massive highway of tiny blood vessels wrapped around every one of those air sacs, just waiting to scoop up that oxygen and transport it to literally every cell in your body. So that's the trifecta. Ventilation brings it in, diffusion makes the swap, and perfusion ships it out. So the design is pretty brilliant, right? But like any complex blueprint, things can go wrong. So how do we know when there's a problem? Let's look at the body's own warning system and the tools doctors use to investigate when things seem off. Your body has its own set of warning lights. Some are pretty obvious, right? Like being short of breath or having chest pain. But some are more subtle, like cyanosis, which is when your skin or lips get a bluish tint because of low oxygen. Or even something called clubbing of the fingers, a strange change in your nails that can signal a long-term problem with your lungs. You know, one of the very first things a doctor checks is how fast you're breathing. And for a healthy adult who's just chillin', that number should be somewhere between 12 and 20 breaths a minute. It's a fantastic, quick indicator of how well your whole system is chugging along. And this really puts it in perspective. On one side, you've got that nice, steady rhythm we just talked about. But on the other, you have patterns that are major alarm bells. Take Cheyne-Stokes breathing. This is a really scary pattern of breathing faster and faster, then slowing down, and then just stopping for several seconds before it all starts over. That is a critical sign that needs immediate attention. When doctors need to get a closer look, they have a whole toolkit at their disposal. They can do pulmonary function tests to see how much air your lungs can hold, or an arterial blood gas test to check your oxygen levels directly. They can get a literal picture with X-rays and CT scans, and if they need to, they can even send a tiny camera down your airway. That's a bronchoscopy, to see what's going on firsthand. Now, let's be real. Not every issue is a major catastrophe. Most of the time, we're just dealing with some everyday glitches, usually up in that upper tract we talked about. Let's cover the stuff that most of us run into at some point. The most common respiratory problem out there by far is the good old upper respiratory infection, or URI. Yep, we're talking about the common cold. These are almost always caused by a virus, which just means your body has to fight it off itself. They're annoying for sure, but they usually stick to your nose, sinuses, and throat. Okay, here's a super practical tip for a really common problem, a nosebleed. What's the first thing everyone wants to do? Lean their head back. Don't do it. The right way is to sit up straight, lean forward a little bit, pinch your nose firmly right below the bony part, and tuck your chin down. A little ice on the bridge of your nose helps too. Now here's a pro tip that so many people don't know about. If you get a bacterial infection like strep throat and you start taking antibiotics, give it 24 hours for the medicine to start working, and then throw out your toothbrush and get a new one. It's a super simple way to stop yourself from just reinfecting yourself all over again. Okay,
Let's shift gears a bit, because sometimes the problems are way more than just a simple glitch. Sometimes we're talking about major faults in the blueprint, conditions that can be incredibly serious and even life-threatening.
This is one of those facts that everyone should just file away in their brain. A major early warning sign for cancer of the larynx, that's your voice box, isn't something dramatic. It's often just a hoarse voice that doesn't go away. If you're raspy for weeks and there's no good reason for it, that's something you have to get checked out. Now, in some severe cases, a person's voice box might have to be removed. After a surgery like that, called a laryngectomy, life changes dramatically. The absolute #1 priority is keeping their new airway in their neck clear. That means using humidified oxygen to keep things from getting dry, and of course, speech therapy is absolutely essential to learn new ways to communicate. All right, now we're talking about one of the most serious conditions there is, acute respiratory distress syndrome, or ARDS. This is basically catastrophic lung failure. The best way to think about it is this. Your lungs, which should be light and airy like sponges, become completely waterlogged and stiff. They just can't absorb oxygen anymore, which starves the rest of your body. You know, the acronym ARDS is actually a perfect summary of what's going wrong. A is for atelectasis. Parts of the lung just collapse. R stands for refractory hypoxemia, which is a fancy way of saying that even cranking up the oxygen isn't helping. D is for decreased compliance. The lungs get so stiff, it's like trying to inflate a block of wood. And S is for a decrease in surfactant, which is the slippery stuff that keeps the tiny air sacs from sticking shut. It's a total system breakdown. Wow. Okay. So after running through the whole blueprint, the design, the warning signs, and the major failures, let's bring it all home. What are the key takeaways? What can we do to protect our own respiratory system? So here it is, your maintenance checklist with a few really useful tips. First, believe it or not, just brushing your teeth twice a day can help prevent pneumonia by reducing the bad bacteria in your mouth. Also, if you have high blood pressure, you have to be really careful with cold medicines. A lot of them can spike it. And one last thing, don't just brush off morning headaches. They can actually be a sign that your oxygen is dipping at night, maybe from something like sleep apnea.
You know, we've gone through this whole incredibly complex system. And the most amazing part is that it all just runs on autopilot 24/7 without us even thinking about it. So I'll leave you with this question. Knowing all of this now, what's just one thing you can do, starting today, to help your own blueprint run a little bit better? Thanks for joining me.